if you will. The fact that African Americans and other members of communities of color were disproportionately impacted by diabetes and hypertension. That was already a crisis, and now we have the crisis of COVID-19 on top of that, and certainly those pre-existing conditions of diabetes and hypertension and obesity are true drivers of more deaths, and particularly more deaths in the African American community. Another issue that is seeing its time in the spotlight is mental health. Certainly, again, pre-COVID-19, we have had a woefully underfunded mental health system in this country. And although we can get to this more in the question and answer period, I hope the audience realizes that the number of suicides has increased dramatically over the last decade, particularly in young African Americans, even in children ages 5 to 12. We have not had what I believe are important conversations on trauma, and so here we are going to be faced with having more conversations around trauma. We are talking tonight, we have the good sheriff here who will talk about the incarcerated population, and so, and yes, Ms. Vanzant will definitely help us get through this. So all issues that we need to make sure we are talking about, so thank you very much. But again, what is evident is the impact on the Black community. We've seen the numbers in Wisconsin, Chicago, D.C., New Orleans, and just today, others may have been aware of this, but people may think that New York is the epicenter, and it certainly is, the number of cases, but the locale that has the highest per capita death rate is in St. John Parish in Louisiana. And so we certainly have to make sure that we are looking at these alarming numbers. And that is why, and one important piece of that is we don't have the numbers that we need to nationwide. Thankfully, we have the numbers in these locations, but we do not have this data. It is incomplete. And that is one of the reasons why the American Medical Association sent a letter to HHS along with the National Medical Association, the National Hispanic Medical Association, and other physician groups, send a letter to HHS requesting strongly, urging that they collect this data by race, by ethnicity, by sex, by zip code. You know, you can't solve a problem unless you have the data and to tell you where to target your intervention. So we certainly need that data, and we need that at all levels, the federal level, the state level, and the local level. We certainly know that we need to prioritize testing. This country is behind in testing. And so we need that data specifically regarding testing, who's getting testing, who's getting referred for testing, who is hospitalized, who dies. And once we have a vaccine or treatment, we need to know who's receiving the treatment and the vaccine. And I will say this, clinical trials are ongoing. It's a larger conversation we can have. But historically, African Americans and others from communities of color have been underrepresented in clinical trials. And so I urge anyone, can talk about that later, to become involved in those clinical trials. So we are at an all-hands-on-deck moment in our response to this, and I look forward to working in partnership with everyone on this call and around the country. And I will finish with saying one last thing: stay home. Everyone can do their part to prevent the spread of this pandemic.
Thank you, Doctor. Greatly appreciate it. Ayanla, let me ask you something. Today, we heard the mayors of Los Angeles and New York City suggest that they don't necessarily plan to see concerts return, possibly sporting events return, until 2021, possibly. It is a daunting idea that people are a little stir-crazy only 2 weeks into this thing. Give me a sense of how we can approach something that I think a lot of people thought was going to be a week or two that seemingly will be a lot longer than that, just to keep that sense of well-being in knowing that many people have lost their jobs, many people have concerns about parents, relatives, etc. How do we find that even keel to walk through this? Because the crisis, the chaos, is really just beginning, quite frankly. Ayanla?
What an honor to be tonight. Yes, can you hear me?
We got you now.
I'm here.
We got you now.
Hello, hello.
We can hear you.
Okay. You got me.
All right.
All right. Yeah. Okay. Yeah, it's quite surprising. It's quite shocking. And the thing that I know is, and I always go to the cultural aspect. Okay? I go to how we are composed and what's in our DNA. And when I think that my just 3 generations for me, 4 generations, that my great-grandmother laid the bottom up without a phone, without social, without where she went to when she got to do this. We can do this. We have to draw on something different than what we're accustomed to, but we can do this. I think that the shock of us thinking it was going to be 2 weeks, and now it's been 5 weeks, that's a lot, but we can do this. It's that we have to now turn in, and we have to pull up what's in there. We have to be creative. We have to be innovative. We have to be faith-filled, focused, and grounded in peace. We have to be. I would rather be in my house for another 5 weeks than in the ground for eternity. So we can do this. It's just that we have to draw on something that we don't always use.
Let me ask you this as relates to...
Go away.
Can you hear me? Ayanla? All right, I'm going to turn to Bennie and see if they can't get Ayanla's...
Yeah, now I can.
You hear me now? Let me ask you...
I can hear you.
Okay, let me ask you as relates to what African Americans are going to have to deal with and people of color. And that is that whenever this is solved in the sense of, and I don't mean ultimately solved, I mean in some of the restrictions being let down and the economy coming back, which will take some time, there will be an economic letdown, a mental letdown, that life is going to be, I believe, looked at pre and post Corona. How do we deal with the trials and tribulations that happen after this first hump? Okay. All right, we're gonna go to Bennie and see if the tech folk can work on that for us. Bennie, let me ask you, because you are Sheriff of Wayne County, you oversee the jails in Wayne County, and I know that COVID-19 has touched your family personally. Give me a sense of the understanding that you have through that personal connection, and then what we are doing for a community, quite frankly, that most people turn away from and don't concern themselves with. And that is, the brothers and sisters and all that find themselves incarcerated.
Thanks for NAACP and BET for having this very important discussion. On a personal note, I've been touched by this in a very dramatic way. I have 9 members of my family have contracted the virus. My brother has been in intensive care for over a month, and I've had 2 cousins who have passed from it. So I've been affected in a way that probably most people ever get affected. When this first happened, my background in 45 plus years in law enforcement has been in emergency management and disaster response. And when we first heard about this early on, the first thing that we did was we contacted the National Institute of Corrections, Center for Disease Control, the American Jail Association, the National Jail the National Sheriff's Association, major county sheriffs, Michigan Department of Corrections, the Michigan Sheriff's, anybody that had the custody of people in a correctional facility to get a sense of what best practices was. And much to my dismay, there was no playbook for this. So we had to kind of invent it going along. Since my appointment as sheriff, I have looked at how ways to reduce the jail population. I operate under the premise that if you're mad at them, find someplace else for them. If you're afraid of them, then you incarcerate them. So I've been constantly reducing the population of the jail since I was appointed sheriff in 2009. When I first was appointed sheriff, we had an average daily population of about 2,200 people. Until recently, we had that number around 1,700. But once this happened, I started looking at a way to get as many people out of the institution as I possibly could. So as of today, we have only 912 people in a jail system that is capable of holding 3,000, which is 700 and about 77 less than I had when this started. So we've been moving people out of the institution in an effort to keep them safe. We've restricted jail visits to only attorneys. Everyone who is coming into jail comes in and out of one point. Everybody has to go under screening if you're coming into the jail to check your temperature. Our inmate movement has been restricted so that the inmates are not getting exposed to people who may be infected. Anybody coming into the jail as an inmate is going to be quarantined for the first 72 hours to see if they are symptomatic. Even after that 72 hours, if they're going to be placed in general population, they get screened by our 24-hour medical staff. Any inmate that is exhibiting any kind of evidence of the COVID virus is separated and quarantined, and any inmate that is tested is isolated and quarantined in one of our 3 jails. We have a special setup. Doing everything we can to try to protect these. The jails have all been cleaned and sanitized. We have had a deep cleaning of all of our facilities and offices. Equipment. All of the inmates have been given masks. All the inmates have been given gloves. Deputies have face shields. They have masks. In addition to that, we have thermometers where everybody's temperatures are being constantly checked. Sanitizers, bio-wipes, disinfectant, cleaning materials, soap. All of the essential supplies to keep the jail sanitized have been given to the inmates. The most important thing about all of this, though, is that we were able to reduce our population. Only people that are in the Wayne County Jail today are people that have been deemed too dangerous to put on the street of this community. Now, they weren't just turned loose, the ones that are out. We have 777 people that are being monitored electronically. And I've had the most aggressive electronic monitoring program in the country since the time I was appointed sheriff. So we're doing our best to keep the inmates safe and the people working in jail, but it hasn't come without a cost. I have 2 deputies who have died from the virus, and 2 of the doctors in the jail have died from the virus. So we continue to pray and hope, and everything that we can think of to help keep the inmates safe, we're doing.
Bennie, let me ask you this before we go back. I understand we may have Ayanla back with us, but let me ask you this. We should note that there are going to be, and there have been, concerns voiced by prisoners even within the Wayne County jail system and throughout the nation. But we should note that this is for people who run organizations like you and a prison system that incorporates so many people. This is not an infallible operation. We are going to have some issues down the line. Do you not want people to understand that?
Oh, absolutely. And I'm familiar with what you're referring to, but the fact is, we have a video that's, been circulated, and the facts that were alleged in there are just not true. All of the inmates do have masks. They have the accessibility to be tested. We don't test the general public unless they show signs. We don't test inmates unless they show some signs. We just don't have the capacity to test every inmate in the jail that is not displaying some symptoms. So I understand they all want to be tested, but that's just not happening in the general population. The other thing that you need to understand is the inmates have 24-hour-a-day, 7-day-a-week access to medical care. They have a medical clinic in the jail. So if at any point they get ill, they have immediate access to medical staff. You don't have that in your house. certainly don't have it in mind. So we have doing the best we can, but again, because this is the first time this has happened.
Yeah. Ayanla, let me go back to you. I understand we have going to get to the phone calls. I understand we are in the midst of having calls come through. So, Ayanla, let me ask you this. Bennie just mentioned the people that he has lost. I've lost a childhood friend.
Yeah.
And cousin.
Okay.
How do we, even as simple as trying to mourn people, go to funerals and things that we are so accustomed to doing and not able to do, how do we get past these things?
We have to really prepare ourselves for a new normal. We really do. And we have to stay present in the moment. And what we can do in this moment is pray. What we can do in this moment is those of us who can be together or communicate in this way, we have to do that. But everything is on a reset, Ed. Everything is being reset. And if we continue to hold on to it has to be this way or something's wrong with the way it is, then we're going to suffer. And so I really want us to open and be willing and be ready to do everything in a new way. Everything. And the day will come, or the time will come, when we can do our celebrations or we can do our services. But right now, to stay safe, we can't do it. And to hold on to the concept that it has to be this way is going to create suffering.
Yeah. As I mentioned, there will be a post-COVID America, and we're going to have to get used to this. President Johnson, let me ask you something very quickly, and then we'll get to the calls in just a moment. But if I may, I'm curious about how you see leadership now and what will have to come. You know, I'm amazed at the media and how they all of a sudden saw this disparity in healthcare that has been in plain sight, quite frankly, for decades and decades and decades. What's the expectation of organizations like yours to make sure that this does not just become a blip on the radar screen and that we see a real sea change in how people of color are dealt with, in terms of their health and how we go forward, if you will?
So when you look at this pandemic, it's clear that this pandemic is a made reality as a 2016 election outcome. But the underlying issue that's the acceleration for African Americans is long-standing public policy, everything from many states not expanding the Affordable Care Act, the access to health care gap that has existed in our community, the food desert and the unhealthy food that we consume, the high stress rates that many African Americans live under because of the lack of true job opportunity. All of those social determinants are things that should have been addressed in public policy years before we got to this point. And so as we look at African American leadership, we need to address the moment, but also the underlying policy implications moving forward. Policy is developed by policymakers. Policymakers are oftentimes elected. November is one of the most important elections that's going to be in front of us because this pandemic was created by the individuals sitting in the White House. And when you want to look at the personal reality, it is impacted by the political outcome, which impacts the policy at the left. So as leaders, we need to address the current, be focused on the future, and recognize the power we have to move people to the polls because it's elections that determine the needs and interests of our community, whether they will be met or they will be left behind. And so for leaders, we must focus on all of those things at the exact same time, the current, the future, and the reality of our activity at the polling box.
Dr. Harris, let me ask you very quickly before we go to phone calls, or as I hear that we have a number of questions already. Dr. Harris, what do you need from our community to make sure that you are equipped and your organization and organizations like yours to make sure that this sense of attention to the disparity we see in health continues to be not just rhetoric, but movement to correct the ills that we've seen for too long?
We are going to have to be intentional because I think we can all admit that there will be lots of things on our to-do list the general public's to-do list after this, and so we are going to have to be intentional about making sure that this stays in the spotlight, and so that's partnership with BET and the NAACP and all of the medical organizations. At the AMA, we have a newly established Center for Health Equity, and so this is certainly on our radar. It has been and it will be, but we're going to need partnerships on this, and we're going to need to keep this in the public eye. Usually after a crisis, everyone takes a breath and moves on, and we are going to have to make sure that we keep this at the top of mind, these health inequities, and that we hold everyone's feet to the fire. There's got to be some accountability to not just talk about it, but to come up with some solutions.
Yeah, and we should note that often we've been talking about health disparities for a long time, but some of the issues that we have to deal with in our community kill you slowly. This is one that hopefully will shock us all into reality, as we have seen people literally die within days of becoming ill, and so we need to make sure that we keep this on the front burner. All right, let's get our first phone call in. Our first question.
We have Angela from Dumfries, Virginia. Angela, go ahead with your question.
My concern is the rural farming area. We have a lot of African Americans that are actually farmers out in the rural areas, and when this virus hit, I really didn't hear too much about how they are going to be working with making sure those in the farming community are taken care of, and not just African Americans, but also the Latina population as well. What are we doing to ensure that they are being taken care of?
Yeah, Dr. Harris, that's a question that we've been seeing about rural areas and how they don't obviously have the capabilities of a big city. What can we do there?
I think that is an important point. We have seen a lot of focus on the urban areas, but in fact, rural areas may just have a small hospital with just one or two ventilators. So I believe our rural communities are even more at risk in some ways than some of our urban areas. And when we talk about African Americans, we know that in the South in particular, we have a lot of African Americans in the rural community. Now, I will say that folks may know that the American Medical Association supported the Affordable Care Act, and we believe that the best path forward is to build upon the progress we've made there. One of the key features of the Affordable Care Act was the expansion of Medicaid. And so we continue, of course, we know that not every state expanded Medicaid, particularly our southern states. So we believe that there is a safety net aspect of this with Medicaid, and we continue to advocate for the expansion of Medicaid that will support rural hospitals, rural physician practices, federally qualified health centers. So we believe that is an important feature to make sure there's access to health care.
Yeah, all of this is going to come down to the importance, as President Johnson said, of voting during the 2020 election. All right, we'll take our next phone call.
We have Dwayne in North Carolina with a question about contact tracing.
Yes. Yes, good evening. Thank you, Brother Gordon, for you moderating and to the panel. I wanted to ask the sheriff, did they do any contact tracing with any of the relatives that contracted the virus?
Bennie, did you hear that?
Yeah. The answer to that question is no. The problem with this virus is that it is so contagious that you really have not been able to lock down from an investigative standpoint where people came into contact with it. Unfortunately, there's been a lot of speculation. Well, this person was here, that's where they caught it, or this person was here, that's where they caught it. No one can say that definitively. At least if it's capable of being done, they have not shared that information with me. So we can speculate, but we cannot say definitively where people have contracted the virus.
Yeah, and I think it's important for us to note across the board that this is something that is just being learned. There are very few definitive answers across the board, and so much of this is people flying blindly as best they can with statistics and without testing to try to give us all answers, and that is so vital for us to remember that. All right, next phone call, please.
Renee in New York. Renee, go ahead with your question.
Oh, yes. Good evening to our distinguished panel in America. Thank you for taking my question. What over-the-counter medications and vitamins can be taken to treat mild symptoms of possible COVID-19?
Dr. Harris?
About this, at this point, there is no treatment for the vaccine. We are in the midst of clinical trials to determine both potential treatment options as well as one day a vaccine. So there is no treatment for the disease, which is COVID-19. Now, if you have a mild case of the disease where you might have fever, some cough, you can, of course, you need to do the things that you would normally do if you had a severe cold or a flu. Make sure you get enough rest. Stay well hydrated. Perhaps take Tylenol for the fever. Initially, there was some concern about ibuprofen, so you might want to take Tylenol again if that's safe. Let me say this, and I want to make sure that I am not giving medical advice. We should not ever give blanket medical advice. If you have specific questions, because I'm not asking you to share your own medical information, but you may be on a medication or have a particular condition that requires a special medical advice. So I would urge everyone, yes, you don't want to go in, but you do want to call your physician. We know, though, that there are many folks who don't have a physician. In most of the states, there's a public health hotline, hospitals that set up hotlines. So for really specific questions about what you should do, you should seek medical advice.
Okay, next phone call.
We have June in Cincinnati, Ohio.
Good evening to the panel and to everyone listening. I'm here in Cincinnati, and I feel like I'm living in a movie, a nightmare. This is just unbelievable, and I'm 60, so I'm at that borderline where, you're at risk. I have an 80-year-old mom, and I had to take her into the hospital, unfortunately, a couple of days ago, and I was left outside, and they were going to do surgery, but they ended up saying that she could heal on her own because she had had a fall. One of the issues is, with this COVID, you lose your right to, when your loved one goes into the hospital, you're denied the right to advocate for them, to look into their care or make decisions. So with this COVID, I guess I would like to ask the doctor, how do we make sure that our loved ones are being treated in the manner in which we feel that they, their care is being taken care of, that, we have rights into decision-making as relates to their care. Secondly, I want to speak in relationship to this being the election year, and since everyone's so mentally overwhelmed by this, how do we begin to mobilize our communities in a grassroots level so that we can get out to make sure that we mobilize people to register and to get them into the spirit of feeling safe to go out to prepare for this election?
All right, so we'll have both the president and the doctor answer that. Doctor, she talks about losing rights. You don't necessarily lose rights, but you cannot. They are dissuading people from actually physically coming in and the like. So explain where we sit on that.
Yes, thank you, Ed, and that is important. This is a tough time, so actually you're not really losing rights, but absolutely we need to, hospital systems, in order to prevent further spread, further illness and death, they are having to limit visitors. I mean, we have all seen the stories of the moms who might not have their partners with them during the delivery, and that is tough. And of course, each hospital is different, and hospitals will have different policies. I would imagine that the policies in New York, where there is such an outbreak, might be different than policies in an area where you have less cases. I will say I would push, and I would contact those at the hospital. Most hospitals pre-COVID had what they called a patient ombudsperson or a patient access and support line. So I would make sure, you might not be able to go in, but I would call the hospital and ask for those folks and who you can call to advocate for your loved ones' health and to be there for your loved ones and help, sometimes even in surrogate decision making. So I would push on that because most hospitals and most health systems do have that. But I admit these are tough times, and this is not a normal time. And the things, as Ayanla said, that we used to be able to do, we certainly can't do during this pandemic, and we will have a new normal after this pandemic is over.
Yeah, we should note, without trying to excuse anything, I mean, it is chaotic in hospitals right now, and it's one of those things that we have to try to figure things out. President Johnson, quickly, if you can, give us a sense of what we should be doing to mobilize. We're not able to do the same kinds of things in terms of, beat the drum out in the streets and try to get people out. So what's our best way to keep the fires burning as we move to 2020?
Well, social media platforms have become one of the main ways that African Americans are able to communicate. One of the reasons why the NAACP we're doing this. For me, it's akin to the place during Hurricane Katrina. As a community, we have to be agile enough to adapt to the new norm. That new norm is to make sure that we both social distance but don't isolate from our community. Because in our community are the answers that's necessary to allow us to survive. We don't lose our rights in this scenario. We gain the opportunity to control our survivalship. We gain to develop perspective. We gain opportunities to sit with our family and understand the journey that we've been on to get to this moment as we navigate the course forward. But also understand that in a democracy, our vote is our currency. And this is not happening just because we woke up one morning. This is a result of a political outcome. An outcome for Black folks that we can control, and always go back to that narrative. Everything in this nation is about politics, and politics are controlled by votes. And for African Americans, we got to understand the value of our carry the moment, and we can save democracy if we truly participate in November.
Bennie, let me go to you very quickly, if I can, in that same circumstance, in terms of the chaotic nature. Certainly you're, having to deal with that on a day-to-day with the prisons and the like in jail. Give us a sense of what you would like people to understand who may be trying to call, find out about a relative that you have incarcerated and the like, and may not be able to get the kind of response they want. What do you want folks to understand in terms of not excusing it, but what you're dealing with on a day-to-day?
Well, it's interesting. I'm glad you gave me the opportunity to talk about that. One of the things, as I told you early on, when we were just trying to figure out how to get this done, we have a vendor that has brought in tablets so they can do remote visitation. And the vendor normally charges for that, but under these trying circumstances, each inmate has been allotted a certain number of minutes free time, both for the video visitation and for the telephone calls. So we are trying to make them available to still talk to folks. You talked about this video early on. That's how the video got out. It came from a tablet that was given to inmates free of charge so that they could contact their family. So we're doing that. We're allowing them to do video visitations and free phone calls.
Okay.
And,
Yeah.
Yeah. And if I could just for a moment, because the woman that just spoke, I can hear
you beat me, but I was going to ask that you could hear it.
Yeah, I can hear it in her voice. And to you, my beloved, and to everybody, I want to say we've got to really flip how we're thinking about this. No, you didn't lose your rights, and I know it feels that way. And as President Johnson said, this is about our survival. What can we do in the meantime? You got a mind. You go home, you sit, you pray, you meditate, you study, and I'm not saying that's going to make the person better. What I'm saying is that's going to keep you from going into break, okay? I a Latin family, that's like, oh, this is terrible. Only one person could view at a time, only 10 people at the gravesite. And my constant word was adjust. You gotta adjust. So I just want to encourage everybody to lift it higher, to see it higher. I know what it may feel like inside, and if that thought doesn't make you feel good, find another thought and replace it, and know that our survival, we can do this. I just want to keep saying we can do this.
And don't you, Ayanla, have to find what works for you personally?
Yes. Yes.
Some people it music, for some people it may be meditation, for some people it may be working out. You got to find what works for you individually, don't you?
Yes. You have to find out what works for you individually, and you have to do it consistently. You have to do it consistently. I get up every morning at 5:30, just like I used to. I get dressed, I put my makeup on, I do what I'm doing, and then I say, okay, well, all righty then. Where am I going? A schedule is important. A schedule is important. Really being focused and mindful in this time, and just, loose in ethos, because your normal daily routine is disrupted. We got to focus. We have to be more. I was about it. I said, if Harriet Tubman were here now, and she was out of this thing, get in line, stay focused, let's go. So there has to be that part of us too. We can do it with kindness and compassion, but we got to stay focused.
All right, let's get back to the phone calls. Next.
We have Ed from Columbus, Ohio.
Hi, good evening. I'd like to thank the presidents and NAACP and BET for hosting this and the panelists for being on. My question is both to Dr. Harris and Ayanla. We have an 8-year-old daughter my wife and I are raising, and as a young African-American girl, she's struggling. She's struggling with the changes and the challenges that have beset her as a result of this pandemic. Again, adults can do all kinds of things to kind of get themselves together. What advice would you give for parents as it relates to helping their children through this and beyond?
So I'll start it, but something that Ayanla, Alagde just said is a routine. So children's routines are disrupted, right? They're out of school. They're missing friends. They're missing birthdays, perhaps. Miss some transitions. And so it's very important to establish a routine. It will be a new routine, and that's okay. I'm not saying you have to be rigid and it has to be the same as it was before pre-COVID-19. But certainly you want to establish a new routine. You also want to answer questions, but answer questions in age-appropriate language. I would be very careful in not ascribing feelings to children. For example, you may say, I know you feel scared for your child, and I'm giving generic advice. I will say that if you have any specific concerns, certainly a pediatrician would be the first point of contact. But be careful not to ascribe emotions to children. Let them tell you and meet them where they are. Also, try to model, not saying that we as adults should not feel our fear, should not have our worry. Those are normal human emotions, but we have to make sure that we are modeling that, yes, we can cope, we can get through this. And so those are just some generic, and I would say ultimately the adults also need to practice self-care, meditate, pray, exercise, as Ed was saying, whatever makes you better able to cope.
I think one of the greatest tools that we have right now is journaling. Journaling. Keep your brain dumped. If it comes up, put it on a piece of paper, write it out. Journal.
All right, we'll go to the next phone call, please.
So a brief announcement, if you want to ask a question, just dial *3 and you can get in the question queue. Also dial *8 for a one-time text on how you can continue to support this program. We will go to Ms. Robinson in Bowie, Maryland.
Can you hear me?
Yes,
Hello?
we can hear you. We can hear you.
Thank you. Okay, thank you so much to the NAACP and BET and all the panelists for hosting this forum to provide information and allow us to ask questions. We learned a lot tonight about what is being done in one specific county for inmates in the justice system, but what is being done for the federal inmates? There was a lawsuit filed by the ACLU because those inmates are not receiving the type of protective equipment that they need. There is no true isolation because of the overcrowded conditions. So what is being done to initiate some type of compassionate release for those inmates? I mean, you have people in there who have not even been convicted of crime, but yet they are not being considered for compassionate release.
Let me give Bennie first crack at this. And Bennie, we should note that part of the issue is beyond the federal piece, which is convoluted as we see every day at about 5:30. You're going to find different scenarios based on who, in fact, the sheriff is from county to county, state to state, city to city.
Absolutely. As I talked about at the top of the show, Ed, once I was appointed sheriff, I looked at who was in the jail and whether they should be confined. Are you mad at them or are you scared of them? And we have had the most aggressive electronic monitoring program in America, but it's not popular among most sheriffs. I know that there are people, America is in low incarceration. We want to, which is why the jail population and the prison population has exploded. But after all of that, we really haven't seen it impact crime in America. We still have way too much crime. We have to figure out something else to get control of the crime situation. We cannot incarcerate our way out of that. I think progressive sheriffs, enlightened sheriffs will come to the realization that it's better to find an alternative to incarceration than to try to incarcerate your way out of this. I talk about it when we have meetings around the country. I can tell you there are parts of this country that thinks that everybody who does anything wrong, from a simple traffic ticket or a simple larceny, whatever, they deserve long prison sentences, and I just don't agree with that.
President Johnson, we should know. Let me suggest okay, go ahead. I'm sorry, Ayanla, and I can back up.
Ben Jones is doing a lot of work at the federal level in terms of the issue of compassionate release. And what I would say to us down here on the ground, you're home. Everybody has a senator, a congressperson, write them. If you have to write them every single day, write them and let us put our voice and our vote out for compassionate release of some of these people in these local and state jails. Write every single day. That's something that you can do.
Agitate.
If I could follow up to that, Ed, I mean, from a pure economic standpoint, my electronic monitoring program saves Wayne County taxpayers about $35 million a year because we're using that alternative electronic monitoring where we, for 24 hours, 7 days a week, we can tell exactly where a person is who is on that monitor. We can restrict where they go. They have exempt zones and inclusive zones. So it's a very good program. I support it. We have very few absconders, and I think that's going to be the wave of the future. People really look at it. A person on an electronic monitoring can still go to work, can still take care of their family, can still do everything. But believe it or not, I don't care how nice your house is. If you have to stay in it, but with it, like people are having to do now, we're finding out that you're incarcerated just the same.
And President Johnson, I want to go back to what we are harping on, rightfully so, I think, and that is when you look at the AG and this administration, we're not going to see the kind of compassion that I think that young lady is looking for from the federal level. Once again, the importance of voting, the people who sit in these positions do matter.
You know, when you look at incarceration, you have a federal system. This administration administration have not shown the most compassion in light of what's taking place. The majority of individuals are locked up in state systems, and we have a lot of problems state by state. The NAACP, we're evaluating joining a lawsuit in the state of Texas because of some of the prison conditions. We're looking at prison conditions in Alabama and Louisiana. And then you have the county jail. And one of the reasons why we wanted Sheriff Napoleon to come on, so we can put a spotlight on how you can keep our community safe and yet have compassion for our family members and individuals who come from our community. We should not create a system where we take people out off the street to put them in harm's way in the midst of a public health crisis. Mass incarceration is a problem. Ayanla Vanzant hit the nail on the head. Ben Jones is one of the leading voices on with federal reform. But overarching, we need a reform system when it comes to mass incarceration across the board. This pandemic has exposed the weakness in our system like it has exposed the weakness in many of our systems across society.
All right, we're going to try to get a couple more calls very quickly. I'll ask the callers to give us a quick question. We'll try to get a quick answer and get a couple more as we are coming up on the top of the hour. So we can go to the next call.
Yes, we have Marianne in Florida.
Hi, Marianne.
Hi, can you hear me?
Yep, we can hear you.
Yes, thank you very much to the panel, to the NAACP and BET. My concern is I'm not a middle-aged woman. I'm a middle senior. I'm 67 years old. I'm doing everything as I'm being told, but I'm very concerned because as I look around me and I talk to other people, for example, my daughter lives in Chicago. There's a concern there because young people will not come off the street. They're still gathering. My son lives in Georgia in a very affluent neighborhood. She says his neighbors are having barbecues and parties. And then I looked out my own window. I live in a condo and I can look over far away. And I saw today a group of young men congregating. They had about 6 cars out there. Nobody had on a mask. Nobody had any protection. And I said, what is going on? Nobody's listening. So my concern is I'm hearing all this about, the things that we know are going on in the Black community before COVID. But right now, we got to save some of our young people. They're talking about the old people. We're staying home. It's the younger group that are refusing to believe because they're listening to everything on social media. I talked to my grandson. He was like, well, it's not going to hurt me, Grandma, if I get somebody to do my hair. I said, yes, it is. That's why you're barbecued.
Dr. Harris, let me give an opportunity to answer that, and that's a question of, you can't legislate ignorance, but we are seeing it continuously, quite frankly, and as she suggested, in every state in this country.
Yeah, unfortunately, this is frustrating. I think the sheriff mentioned, I believe, Sheriff, and you can correct me, that 2 physicians have died. And so you see physicians and nurses and even those who clean our hospitals and facilities are losing their lives. And so I just urge everyone to really stay home and realize that what you do as an individual has an impact, and you staying at home keeps the rest of us well. And then I'll open it up to all of us because certainly I believe this is about the misinformation. Remember, originally young folks, believed that was a myth, that they could not become infected. That was misinformation. African Americans could not become infected. Children couldn't. So here's an opportunity for all of us, and I'm all ears, and certainly I know we need a sort of a grassroots effort on this. I want the community to tell us how best we can communicate the risk and a lot of this misinformation on social media. We have called on social media platforms to really monitor this misinformation that's out there because it's deadly. It is deadly.
Yeah, and we should not as a community be afraid to call up folks who are doing wrong. Too often we kind of sit on the sidelines and you don't want to be that person, that neighbor, that old guy from the porch saying, get off my lawn. But it is time for all of us to, quite frankly, police our communities. If we see gatherings, whether you feel comfortable, if you need to call someone else, but we have to start breaking these things up, and we have to stop being hypocritical. I have friends who know better, who are shuttling people back and forth between houses. So some of it need be, and some of it is just kind of habit, and it's what you do. I know a couple of people who are still sneaking to the barber. You know, I got the Frederick Douglass look, man. I'd rather have this than, as Ayanla said, you know, somebody giving our eulogy, so we need to do that. Ayanla, we're going to give you just a couple of minutes, if you will, before we close this out, to give us all something to think about. So often we turn to you in periods like this to look for words of wisdom. So if you would. Ayanla, can you hear me? Ayanla, can you hear me? All right, Derek, I'll see if I can go to you.
Derek, every day on Facebook, and I said, yeah.
All right, I think we have you now.
I think Derek is gone.
Okay, can you go, Ayanla?
Me?
Yep, you.
Do you have me?
Yep, we have you.
Yes. Let me just say, all things are lessons that the Creator would have us learn. All things are lessons that the Creator would have us learn. We are learning individually. We are learning collectively. We're learning as a community, as a nation, as a race of people. Find the lesson for yourself and share it. In terms of people not paying attention, I have a grandson who's out there with no mask and no gloves. And every time I see him, I call him out. When you see somebody without a mask, call them out. Learn how to, yes, write your senator, write your congressman, and let's make a plea for compassionate release. Let's stay focused, let's be concentrated, let's take care of ourselves, but let's also be active. Let's also be active as opposed to afraid and worried and stressed out. Let's also be active.
Ayanla Vanzant, thank you so very much. Dr. Harris, thank you so much for being a part of this. Bennie, Napoleon, my best to you, not only with your family, but also your work family. I know it's been rough. Detroit is my home, and it's been hit very, very hard. And I would just, before I turn it over to President Johnson, suggest to all of us that, you know, we all love to dance to Frankie Beverly. And he's got that classic song, We Are One. We like to say that, but we don't often live it. But now is the time for us to live it. It really is about us being one, a collective sense of family. You know, we like to talk about, hey, brother, hey, sister, hey, mama. Well, now is the time, not just to talk about it, but to live it. President Johnson, we'll hand it over to you to wrap this up for us.
You know, thank you, Ed, and thank all of the participants for this evening. As we've discussed, Black Americans are disproportionately bearing the brunt of COVID-19. We are losing loved ones and cuts in our paycheck, and we're losing our jobs. It's the role of NAACP to continue to bring timely information during this pandemic because we are all we have. We are all we have in terms of ensuring that we provide each other with quality information to ensure that we check in with the loved ones that's so important to us, to ensure that our young people are provided with the type of quality guidance that's necessary. And for the NAACP, and now in partnership with BET, that is the role that we're bringing forward. And as we are adjusting how we do our work as an organization, we ask you, our members from across the country, over 21,000 people who are on this call this evening, to continue to support the NAACP, continue to provide positive information. On your phones, if you can hit *8 and receive a text message, because as an organization, we need your support so we can support the quality information that you heard this evening on the call. Again, *8. I want to give a special thanks out to Ed Gordon. It made me feel like I was watching News and Notes on BET. Such a good moderator of these type of conversations. The inspiration that's been provided by Ayanla Vanzant. Dr. Vanzant, I have people on a group meet that's a part of a leadership group, and and they're saying, give us a shout out. And one of the young ladies is a district attorney in Adams County, Mississippi, and she really appreciated Sheriff Napoleon, the information you're providing, and going to the chief to make sure that the jails in Adams County is treated the same way that you are navigating the jails in Wayne County. We are who we are looking for in this time of need. We are the leaders we are supposed to be. It is incumbent upon all of us, those on the call, those on the screen, to lead in this moment so that our community can come through this storm stronger, better, and focused. And finally, to Dr. Harris, continue to be the medical voice our community needs. You've broken ground by heading up the American Medical Association, but we are proud to look at that screen and see a sister who can speak plain, clear, and give us the facts. Thank you all for joining us on this call this evening. Again, on the call, hit *8. We need your support so we can continue to support the things we are doing to get information out. Have a blessed and wonderful week.